My name is Nancy Reed, and I'm a volunteer with the Colorado Foundation for Universal Health Care.
I am going to talk about 2 ways that we can broaden and strengthen support for universal health care. First, we can tell our stories about the health care injustices that we and others have experienced. We can do this because we all live the reality of this dysfunctional American healthcare system. In our country, when someone tells you about a medical concern they have, they usually don't tell you about the care they receive. Instead, they tell you about the barriers of cost and red tape to the care that they need. This happened recently when my husband had eye surgery. Medicare covered it, we only had a small out-of-pocket expense. But the day after his surgery, I was sitting next to a woman with an eye patch on. She told me her name was Kathy, that she was a hairdresser with her own small business in Colorado Springs. She also said in her 63 years of life, she had never had any medical problems until this retinal detachment. Unfortunately, this was the day after her 3rd surgery in an attempt to restore her eyesight. She also told me that she hadn't been able to pay for health insurance and that she had paid for the ACA penalty. Now she was receiving thousands of dollars in medical bills that she was paying with maxed out credit cards, and she would be paying off her medical debt at credit card interest rates. She was not only so anxious about losing her eyesight, but she felt her choices in life were closing in on her, even her ability to retire. Now, if Kathy had only been 2 years older and qualified for Medicare, or if we lived in a country with universal health care, she wouldn't be in this position. We can be confident when we tell these stories because the facts support both the need to change our current system and the wisdom of embracing health care for everyone. But experience has shown us that facts alone are not enough. So the second way we can advance universal health care is to speak out with our values. We have taken our cue from cognitive scientist George Lakoff, who urges us to go beyond the facts and present a clear moral vision for our country. Much of what I will say you already know. The important take-home is for us to become comfortable framing our message with our language and our values. Then we need to repeat it so that others begin to think with this language and these values, releasing them from the negative and restrictive framing that has prevailed. We want to cut through the noise of patchwork fixes and fragmented, divisive proposals and elevate the debate to one where the majority of Americans are given the opportunity and the space to support health care for all. I will start with a quick overview of some of the problems with our current system, but then I will turn to our fundamental beliefs that health care is necessary for freedom, equality, life, and a good and healthy society. Next, I will show that by failing in its role to protect and empower people, our government denies us freedom, justice, and fulfilled lives. We will then look at a way forward for universal health care that most people will support. Finally, by telling our stories and speaking out with our values, we stand with the majority of Americans who believe that a healthy democracy demands guaranteed quality health care for all, for life. Okay, let's look at it. It is true, or perhaps it is true, that we lead the world in medical research and technology. But our system denies care to millions of people. Our system costs twice as much as the average cost to comparable countries. And they provide care for everyone. Our system is fiscally irresponsible with both our personal funds and our collective tax dollars. Our system is a bureaucratic nightmare in which the number of administrators whose job can be to deny us care is rising much faster than the number of people who provide us care. We have a system where bills are often irrational, mysterious, and unreasonable. Today, the U.S. ranks a disgraceful 42nd in life expectancy and has an immoral and shameful maternal mortality rate that is 3 to 5 times higher than comparable countries. But we often believe that if we just tell people these facts, that we will convince them. Facts are essential, even in our current fact-free political world. But it is important to realize that people vote with their values. So now let's turn to the values that we can share with others that demand we change these facts and this system that denies human dignity and weakens our country. We believe that every person has a right to life, liberty, and the pursuit of happiness every bit as much as the signers of the Declaration of Independence. We are working to promote the welfare and find liberty for all of us, just as the authors of our Constitution. We have a government that was created to be of the people, by the people, and for the people. The U.S. was founded on the belief that freedom and self-fulfillment require a democratic government that will protect and empower its people and embrace the values of compassion and empathy. It is only with empathy that we can understand how to provide protection and empowerment. Empathy is how other people become real to us. Being open to other people allows us to recognize their humanity and how we are all connected. Healthcare is a basic human need. We believe that our fundamental democratic and human values of caring for each other will ring true with Americans of all backgrounds. So it is important for us to understand our values, link the facts directly to these values, and speak them out loud every day. This is not always easy and takes practice. We all need health care because we all live in fragile human bodies which will get sick, injured, and die. This is inevitable. Life is uncertain, and health is only a temporary status. Just like safe food and clean water, we need health care. Much like fire and police protection, national defense, and waste disposal, health care safeguards us. We believe, just like Franklin Roosevelt, that we should have freedom from want. He defined this as an economic understanding which secures healthy lives for everyone. Only then can we have lives that are truly free. So let's look at the way our government limits our lives and our freedom. We can't be free if we can't afford care or medications, if we're bound to dead-end jobs we hate, or can't go part-time to care for a child or an elderly parent just to keep our health insurance. We can't be free if medical debt, anxiety, and illness shackle us. In the U.S., hundreds of thousands of people have medical-related bankruptcies every year. This includes people who have health insurance. People who live in countries with universal health care are free from this worry. We don't have freedom if we lose our health care, because we lose our jobs, because we are sick. Serious illness without care takes away our liberty and threatens our lives. Our country can't be well if its people are not well and able to live up to their potential. We believe that everyone should have the care they need to stay well, and everyone should be taken care of when they are sick or injured. Yet, healthcare is rationed by the cost of premiums, deductibles, and co-pays, and by where we live in our age. Healthcare is now beyond the ability of millions of Americans to pay for it. This is unjust. And as Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. We need to take over the debate. Government has a right and a responsibility to govern and a moral mission to empower all of us with public resources and provide us equal protection as laid out in the 14th Amendment. Instead, our government has abandoned this role to corporations whose interest is not protecting our lives and liberty or even paying for our health care. In 2016, I had Anthem insurance. I paid hundreds of dollars a month in premiums. I had a $6,000 deductible. You know, the amount of money you have to pay for your insurance will start helping you pay your medical bills. Well, I have never paid down my $6,000 deductible, and it starts all over again every January. So Anthem kept all of my health care dollars, and with my money, besides paying for their profits and their outrageous executive salaries, they used my money and other people's money to spend $1 million to fight Colorado Care, a campaign that I was working on and supporting. They did not use my money to pay for my friend Ralph's cancer surgeon, despite the fact that Ralph had great insurance through his employer. An administrator, after his surgery, determined his surgeon was out of network, so they kept my money and didn't pay Ralph's benefit. The companies have created barriers to health care, such as deductibles and narrow provider networks, so they won't have to pay our medical bills and can instead keep our money to increase their profits and lobbying dollars. When corporations deny the care we need or make it unaffordable, they deny us liberty and can deny us life. We have lost our way. Jonas Salk did not seek a patent when he invented the polio vaccine. He said, "Can you patent the sun?" But today, big drug companies price life-saving medications out of the reach of people who need it to save their lives. There is no moral obligation by private corporations to protect our lives and our liberties. Our government has been siding with big medicine over the American people. We can explain to others that a free market system cannot and has never provided health care for everyone, because you can't make money by covering sick people. So markets look for ways to exclude them. We need a system that pays our medical bills, cares for our people, our values, and our democracy. This would be a universal health care system with comprehensive, integrated, and preventive care. When you care for people throughout their lives, it costs less to keep them healthy. It's well established that preventive care decreases illness and death and lowers costs. I have a conservative neighbor, Dee. She does the books for her husband's small construction firm and drives an hour each way to a part-time job. They were struggling to pay $1,000 a month in premiums with a $6,500 deductible. Being in her 50s, Dee followed the recommendation to have a colonoscopy. This is both a personally and socially responsible decision. And although required to be covered by the ACA, she called Anthem to make sure and found out that yes, it was covered. But if they found anything, it would be reclassified from preventive to diagnostic, and she would have to pay for it. The insurance company was not only undermining the ACA requirement, but acting in defiance of the benefits of preventive care, to find medical issues early when they can be cared for easily, preventing costlier treatment and suffering later. No one at Anthem could tell her what it would cost. Dee was outraged. She said her husband's business could not function without him and his customers knowing what things cost. Dee has never had a colonoscopy, and if she ever gets colon cancer, it will not only be expensive, but she will suffer and maybe die. We need to let people know that our system works against human dignity and denies us the ability to be responsible and to make good health care decisions. And by the way, Dee now supports improved Medicare for all. All comparable countries have universal health care. They have figured out different ways to finance it, but they have one thing in common, as TR points out in his book, The Healing of America. each country first decided that everyone should have health care. So this is why speaking out with our stories and our values matter. We first need to decide as a nation, that providing health care for everyone is what we want to do. Once we have done that, we won't have to look to these countries for how to do it. Our Medicare program costs less to administer than private health insurance while covering the oldest and sickest of us. Medicare has simpler and continuous coverage. It's not tied to employment or marriage. It's a single-payer system, which means that we pool our money together and that pool of money pays our medical bills. We understand that taxes are the income needed to pay for government services that can make our lives better. Today, our income is being neglected and depleted. We believe we must pay our dues to be part of a civil society, to invest in ourselves and in our country. Medicare is not free. It is publicly financed and is privately delivered without the narrow networks of insurance companies.
When we cut out the administrative costs of the various middlemen who profit from our health care dollars instead of paying our medical bills, we will pay less. Middle-income families now pay between 4 and 15% of their income on health care. Under Medicare for All, they'll pay an average of 1.6%. 95% of households will pay less with improved Medicare for All.
Medicare for All is a proposal Americans will support if they understand the underlying values. After World War II, health insurance became connected to employment. Insurance company exclusions of pre-existing conditions and the high cost of coverage made it impossible for the elderly to get care. Companies were not interested in covering people 65 and over. They wanted a healthy pool of people where they could make the most money. Our country recognized that those people over 65 were vulnerable, in need of care, and had to be protected. So we established Medicare. Well, wages have been flat for 40 years. Medical industry profits reaped from our healthcare dollars are higher than ever. Costs have skyrocketed, and it is impossible for millions to afford care. Now all of us have become vulnerable. There is every reason to treat us the same as people 65 and older by providing health care and equal protection for all Americans. So with an improved Medicare for All system, our medical bills will be paid, will be protected against financial ruin, and providers will be able to care for their patients. In sum, U.S. policies deny millions the health care that is necessary for life, freedom, equality. Our government is not providing for the general welfare nor securing liberty for its people. Expanding and improving Medicare for All is a solution in our grasp. President Roosevelt believed that our nation's destiny is in the hands and the heads and the hearts of its people. Well, polls show that most of our hands and our heads and our hearts believe our country should provide health care for all of us. At Gettysburg, President Lincoln stated that it was up to the living, well, that's us, to dedicate ourselves to the unfinished work of freedom and equality. In honoring those who had died, he implored us to increase our devotion to a government of and by and for the people. Democracy demands our participation, and we will participate by telling our stories and speaking out with our values for what is right and rational and just for the people of the United States.
Everybody in, nobody out. Thank you.
We're glad you can join us. Here's another example of why we need universal health care. If this was helpful, please click on the like icon below. If you want to know when we release new videos, click on the subscribe button. In our America, the decisions are made by those who show up. Will you show up?